Hi, and welcome to Baby Steps. I'm Heather, an OB nurse and lactation consultant here at St. Luke Community Healthcare. And joining me today, I have Dr. Isaac Billings.
Hello.
Thank you for being here with me, Dr. Billings.
Thank you.
Dr. Billings and I want to talk to you guys today about using marijuana during pregnancy and breastfeeding. Okay, so Dr. Isaac, are babies exposed to marijuana during pregnancy if the mother is using marijuana? And what about breastfeeding? Does marijuana get into breast milk as well?
So that's great questions. The answer is that yes, babies do actually get marijuana into their own bodies if mom is utilizing marijuana during pregnancy. And it's probably around 10% of the mom's circulating blood level of marijuana is what's also in their baby's body as well. And that actually brings up this question about, well, what about brain development and spinal cord development in babies and infants and children moving forward, and is that going to increase my child's risk of having behavioral problems in the long run, depression, anxiety, increased risk of drug use? The answer is that there is an association between marijuana use and those outcomes in the long run, both with marijuana use during pregnancy, breastfeeding, and with marijuana use in young kids who start utilizing marijuana and continue utilizing it moving forward. There's lots of potential issues with some of those studies, and we don't necessarily have to get into all of that right now because it's most likely not just marijuana alone contributing to some of those things that we're seeing, but it's very important for moms to know that yes, there is an association between marijuana use and those sorts of problems. Now, breastfeeding, does it get into breast milk? The answer is, again, yes. Marijuana really likes fatty tissue, and it binds to that fatty tissue and stays there. And what is breast milk? Well, it's loads of fat. And marijuana does concentrate into the breast milk. So your child does get exposed to marijuana with breastfeeding. And it's not a tiny dose that they're getting either, right? It's probably a reasonable dose of marijuana that they're getting if you're utilizing marijuana regularly while you're breastfeeding. And again, the potential for adverse outcomes is there. We know that marijuana affects how the brain develops in animal studies that we've done. Obviously, we don't do those sorts of studies on humans, but in animals, when you expose them to marijuana during in utero development while it's still inside the uterus and developing, and then afterwards it changes the structure of the brain and the spinal cord and the processes of that central nervous system. So the potential for risk and harm is definitely there.
Okay. So, Dr. Isaac, what about moms who choose to use marijuana anyway? What is your advice?
Perfect. I appreciate that question because certainly there's going to still be moms out there who feel that their benefit that they're getting from marijuana use outweighs the potential risks, and those benefits may be management of nausea and vomiting, being able to actually get food and water down. Maybe they have horrible insomnia or PTSD, post-traumatic stress disorder, or severe anxiety, and they feel that they're getting a lot of benefit with marijuana use. My recommendation to moms that I see in clinic in that setting is that we know, or it's at least demonstrated in the research that's been done, that the more marijuana that you use and the longer that you use it in pregnancy and breastfeeding increases the risk of the adverse outcomes that we're worried about. So if you use less for shorter periods of time, or say you use marijuana in the beginning of your pregnancy, but then you stop using it, at a certain point in your pregnancy and don't continue utilizing it, that minimization of the amount of marijuana you're using probably does decrease your risk of harms. So my recommendation is the smallest amount that you need to get the effect that you're after as little often as possible if you're going to continue to utilize marijuana.
Thank you. Dr. Isaac, thank you so much for being here. We really appreciate you coming to help present on this very important topic for our moms and babies. I do want to let everybody out there know, if you are interested in information about quitting using marijuana, or if you need help, please reach out to your providers. We're all here to help you have the healthiest pregnancy that you can. I also want to remind you that we do have childbirth education available, and you can find more information about that on our website. So stay tuned, and we have more baby step videos coming up.